Hi guys, welcome to my YouTube channel. My name is Nurse Hlalis and I am back with another video today. If you are new here, welcome. Please do stay. We love having you here. If you are a returning subscriber, thank you so much for coming back. You know we absolutely enjoy having you here, and thank you for being an awesome part of the Nurse Hlalis family. If you enjoy this video, please give it a thumbs up. Please subscribe to my channel and click on the notification bell so that you can always be notified when I post a video. And this is especially important for the people who are here for the first time. Please do join the family and subscribe to this channel. Also, please do leave your comments in the comments section. I really love it when I see you guys engaging with me and commenting. It really helps me to see that what I am doing is worthwhile and I'm doing this for people. It's really heartwarming to see a response. So I really appreciate it when you guys leave a comment, and I really encourage that you do leave a comment. If you have suggestions, if you want to comment on something that you liked about the video, or if you just have your opinion to share, I really appreciate that. So the topic of today is, today we'll be doing something a little different, and as you can see, today I just decided to be a normal person and not be a nurse. Today we're doing something a bit different. Today we're talking about cash money, finances, and this video is part of the pregnancy series, so it's part of that journey of planning or preparing for pregnancy. In today's video, we will be comparing public and private healthcare, and especially maternity care in South Africa. So that's what we will be talking about in today's video. So if you are pregnant at the moment, if you are planning to fall pregnant in the future, then I suggest that you stick around to watch this video, because I think it's really important for a woman to be able to think about this before she falls pregnant or early on in her pregnancy, so that she can be able to choose the type of care that she will have in her pregnancy, whether she will be getting her care from a private hospital or governmental facilities or public. And I really encourage you to stick around and watch the video till the end, because it will be worth your while and you're really gonna learn a lot. So without any further ado, let's get on to the video. Okay, so the first type of care that I'm going to talk about is private healthcare here in South Africa. And I'm going to talk about the different stages of pregnancy. The antenatal stage, which is the stage of pregnancy before you give birth. And then we're going to talk about the childbirth or labor stage. Then we're going to talk about that period of time, which is after you give birth to your baby. What are the costs involved in private health care? What are the facilities that you can go to? And what are the specialists or professionals that you can see during this time of your pregnancy, whether it is a doctor or it's a midwife, right? And I just want to say before I started this video that I am a midwife. I am a nurse. I'm a professional nurse and a midwife. So yeah, I will talk about that and where do I fit in this whole spectrum of things. And then after talking about private healthcare, I'm going to move on to speak about public healthcare, the facilities, and when do you see the different professionals in public healthcare and the cost, which is the most important thing. That's why I'm doing this video. The most important thing is the cost. So let's get on to the first part now of this video, and we are talking about private healthcare. All right, so the antenatal stage of your pregnancy, it will start the moment that you realize that you are pregnant, throughout your pregnancy up until just before you give birth, right? So that will be the antenatal stage of your pregnancy. And when you are pregnant, going through pregnancy, from that time that you figure out that you are pregnant, you need to obviously go for certain tests, go for certain checkups, for visit at your hospital or your clinic or with your doctor or your gynae before you give birth, to ensure that you are fine as the mom, to ensure that the baby is fine, right? So let's talk about the different types of professionals that are involved in the stage of pregnancy, which is before you give birth. So in this part of pregnancy, we have your obstetrician and your midwife, right? So if you choose that you don't want to go for your checkups at a public hospital and you don't want to give birth at a public hospital, then this part is for you, right? So the two types of professionals, health professionals specifically, that will be seeing you during this stage are your obstetrician and your midwife, right? You have to see an obstetrician if you are having a high risk pregnancy. And then if you're having a low risk pregnancy, then you will be seeing a midwife. Well, you can choose whether you want to see a midwife or you want to be seen by an obstetrician. Okay. So what is an obstetrician? An obstetrician is a doctor that specializes in pregnancy, in childbirth, and in women's reproductive health, right? So if you are pregnant, that's the doctor that you will be seeing. Okay, so where do obstetricians work? They work in private hospitals. I'm sure you know your private hospitals. I won't mention them, but they work in private hospitals. And then some of them, they also have their own private obstetrician units or practices. So the doctor will either be working at the private hospital or they are working at a private hospital and they have their own practice where they see pregnant women. Then how much would you have to pay to see this certain type of doctor? So I found many different articles and they have different ranges of costs for this service. But on one article that I found, they said that with an obstetrician, you can pay for your antenatal visits, which are the visits that you have to go through before you give birth. You can pay something around 400 to 1,200 with an obstetrician, right? That could even go up to 2,000 rand for one visit. It just depends on who your doctor is. It depends on what they charge. I believe that different doctors charge differently, maybe according to their experience or expertise. Yeah, so that price will range. It can go up to 2,000 for one visit. So who are the people that have to attend with an obstetrician during their pregnancy? So these are your high risk pregnancy, women that have high risk pregnancies. And how or when do you become high risk pregnancy? If you've had a previous cesarean section, if you are advanced maternal age, which is you are above the age of 37, if you are having a multiple pregnancy, meaning that you're carrying twins or triplets, if you have hypertension or high blood pressure in pregnancy, or you've had it in a previous pregnancy, or diabetes in pregnancy, things like that. Those are some of the things that put you as a high risk pregnancy. If you either have medical conditions or you've had complications in previous pregnancies. Some of the complications that I can think of at this time is things like you've had intrauterine death, so you gave birth to a baby that had already passed away, or you had any other complications with the baby while you were pregnant in your previous pregnancy. So those are the people that would now absolutely have to be seen by an obstetrician. And now obviously obstetricians will be more expensive because doctors are more expensive. But if you have medical aid, your medical aid will cover that. And if your doctor charges more than the rate of your medical aid, then you would have to add some money on top of that. But I'm not going to be talking about medical aid in this video. I'm literally just going to be talking about the costs involved, right? And what I can say is that if you are in private, then it would be great to have a medical aid, because the prices for private healthcare are quite expensive to take out from your pocket, unless maybe you are having some sort of savings. Yeah, not that you can't pay from your own pocket, but it is slightly more expensive. And many people who are on medical aid will choose private healthcare. So that's your obstetrician, right? For your antenatal care. What about your midwife now for antenatal care in the private sector? So, okay, let me just talk about what a midwife is. So a midwife is basically a nurse, a professional nurse. Yeah, so as professional nurses, we are also midwives. Um, yeah, so your midwife will be working at either a private hospital or at a private birthing unit. So a private birthing unit is a place where you can give birth, and it is run by midwives only. There are no doctors there, except for the doctor or the obstetrician that will be working with the midwives in case there are complications. So midwives will be having a doctor that they are affiliated with, and specifically an obstetrician, because it's the obstetrician that specializes in pregnancy, right? So you can go to a midwife birthing unit if you are having a low risk pregnancy. So you cannot go to a midwife for your antenatal if you are having a high risk pregnancy. It's only if you're having a low risk pregnancy, you had no complications in your previous pregnancies, or you're a first time mom and you're literally starting off on a clean slate, then you can be seen by a midwife throughout your pregnancy. So if you are going to a midwife, your midwife will either advise you to have 2 visits with an obstetrician, to do like a scan. If your midwife is not able to do a scan, then the obstetrician that is connected to your midwife will then be able to see you for those 2 visits, for like that scan that you can do in the beginning of your pregnancy to establish pregnancy and to check out other things. I actually spoke about this in one of my videos, the types of scans that you can do while you're pregnant. I will just link it up somewhere up here so that you can be able to watch and learn about the different types of scans that are needed in pregnancy. So that obstetrician might do the scan at the beginning of your pregnancy, or you can have another scan to check the gender, or maybe they'll do another scan later on in the pregnancy, just before you deliver, just to make sure that everything is fine with the baby, right? So with the midwives and your antenatal care, for the first visit, you can probably pay something like 300, between 300 rands and 750 for the first visit, and you would be spending something like an hour to 1 hour and 30 minutes with the midwife. And yeah, the first visit is a bit longer because there's a lot of things that need to be done: admin, blood test, physical exam that needs to be done. So this one will be slightly more expensive and might take a lot more time. But then your other visits after you go for the first time, your consecutive visits with the midwife can range anything from around 300 to 750, or around 250 to 400, depending on where you are, depending on the institution, depending on the midwives and how much they cost. Yeah, so that's basically the cost. So if you are comparing them, you can see that the midwives costs are less expensive compared to the obstetrician's costs. So really, if you are having a low risk pregnancy, you do not need to go to an obstetrician unless you're going maybe for like a scan or for those 2 visits during your pregnancy. But you literally do not have to go to an obstetrician throughout your whole pregnancy, especially if you are low risk. Then if you are high risk, you definitely do need to be seen by an obstetrician throughout. All right, so that was the antenatal part of things and the costs that are involved and the professionals that you have to see during that time. So now let's move on to the childbirth or labor stage. What are the costs that are associated now with this period where you have to go and deliver now at a private hospital or at a birthing unit, depending on whether you are high risk or low risk? So that also applies. If you are high risk, you will have to deliver at a private hospital, obviously, where you can be monitored closely for any complications, and interventions can be made very quickly if there are complications that arise. So one such intervention should you have complications, would be a cesarean section. So if you maybe let's say you are just above the age of 37 and you've had a normal pregnancy throughout, in private, if you are working with the obstetrician, you can either choose whether you want to have a vaginal birth, a normal vaginal birth, or you want to have a operation, which is a cesarean section. But if you don't have any risk factors that would prevent you from having a normal birth, you can still try to have a natural birth, even if you are having a high risk pregnancy. Just as I made the example of someone who is advanced maternal age, but everything that had to do with her previous pregnancies was okay, just that she's older, and that's why she would have to be attending with obstetrician at our hospital, right? So here with the cost of an obstetrician, if we're looking at childbirth, you can pay anything from around 16,000 to 25,000 just for birth. So that does not account your antenatal visits. It's strictly just for childbirth. You can pay anything from 16,000 to 25,000, right? And then if you have to do a cesarean section, possibly because you are having complications at childbirth, then the prices will be higher. It will be more expensive because with your cesarean section, there will be the different costs that are related to the different health professionals that have to be there during your operation, like your obstetrician that will be delivering your child or doing the operation. There's an anesthetist. Like this word is just so difficult to pronounce. It just makes me go-ish. Like I literally go-ish when I have to say this word. An anesthetist or anesthetist, whatever you choose to call it. But yeah, that's a doctor that will be doing your epidural, giving you that injection in your spine that's like gonna numb you, or the doctor that will be giving your anesthesia to numb you while you are having the operation. And then there's a pediatric doctor that is also involved that will be looking after your baby after you give birth, to check and ensure that there are no problems with the baby after birth. So with your obstetrician during your childbirth or your operation, they will charge around like your 12,000, and these prices vary again depending on the doctor, right? Maybe your anesthetist will be charging around 5,000, and your peds doctor will be charging around like 2,000 or something. So again, if you have medical aid, your medical aid has a certain amount that it will pay for your childbirth. So if we look at that, this can go up to like 20,000. So hence we had that price of like your delivery can cost anything from 16,000, between 16,000 and 25,000, right? Because you're paying for the hospital, using the hospital's equipment and the doctor's services. So you can pay anything up to 25,000 just for that delivery. Yeah. And you know, I found, as I was doing my research, I found that if this is with an obstetrician, you can be paying around like your 25,000 for a natural delivery. When it comes to a cesarean section, pay more. So that will be your price more or less for the operation or for your delivery. Now, if you are at a private hospital and your doctor was an obstetrician, you also need to think about your hospital stay. How long will you stay at the hospital after you give birth? So it will be different prices, whether you had a normal vaginal delivery or you had a cesarean section. And obviously now cesarean section will be more expensive because you will need more equipment because you had an operation, and you'll need more care during that time, as opposed to someone who just had a normal vaginal delivery without any complications and the baby is fine. Your hospital stay can go up to 40,000. Now that's not the delivery part of things. That's your hospital stay is a separate amount. So you can pay up to 40,000 for a 3-day stay at the private hospital. And then if it's at a private obstetric practice, and your doctor was from he had his own private practice, maybe you might pay something like between 20,000 and 30,000. Yeah, but again, it varies with the institution, it varies with the doctors that you're having. So I think the take home point here would be whether you're having a natural birth or an operation, there's a certain amount. The doctors that will be taking care of you, the different doctors, especially if you are now having an operation, there's a different amount. And your hospital stay, how long you'll stay at the hospital, and whether you have complications arising and anything that goes wrong while you're giving birth, that will affect the amount of time that you stay in the hospital. So those are the things to think about. And your medical aid might cover maybe a standard 3-day stay at the hospital, or if you've had a cesarean section, they might cover 4 days. Yeah, and you might find yourself having to pay the excess if the cost, and also depending on your doctors, if it's more than what your medical aid pays. So those are the things to consider if you are going with an obstetrician. Now, what if you are going with a midwife? You are having that low risk pregnancy and you can literally just have a natural vaginal delivery if you don't have any complications during your antenatal period, and even when you give birth there are no complications, everything goes as planned, then you can give birth with a midwife. And with a midwife, you have 3 options. You can either give birth at a private hospital, you can either give birth at a midwife's unit, which is called a birthing practice. So midwives, they do open their own practices where they help women throughout their pregnancies and to deliver as well. So you can give birth at the birthing unit at a private hospital, or you can have a home birth. Now this is the nice thing about midwives. Midwives are all about natural delivery, and throughout your whole pregnancy they'll be working with you in such a way that they will try by all means to ensure that you have a natural delivery. Well, that is if you don't have any complications or anything that requires you to see an obstetrician. Yeah, but we as midwives, we are all for normal vaginal births. And later on in my channel I am going to do a video where I will be comparing the 2 types of deliveries. Natural vaginal birth, what are the advantages and disadvantages, and I'll be comparing it with the operation or cesarean section. Right, so your private midwife, if you are having any complications, as I said, private midwives and at their birthing units, they are affiliated or connected with an obstetrician that can see you if there are any complications that will arise during the pregnancy. And then also they will be affiliated or connected with a private hospital should there be any complications and you need to be transferred to the hospital. So you can pay anything from 8,000 to 12,000 with a midwife, or it can be anything between 10,000 to 15,000. And as we can see, the midwives' fees or costs are more affordable than your obstetrician one. So if you really absolutely have no reason to go to an obstetrician and you are having a low risk pregnancy, you're a first time mom, midwife is your best bet. Midwife is your best bet, because literally you won't be paying that much with the midwife. So yeah, those are the costs that are involved with your delivery or your childbirth when it comes to private health care. Now, what about the stage that is after you give birth? Alright, so if you were attending with an obstetrician throughout your pregnancy and you go through childbirth, and let's say you have a normal vaginal delivery and everything is fine with you and the baby afterwards, then the amount that you will pay, it will also now vary because of the different costs. Because now after you give birth, you need to be assessed by your doctor again, and the baby will need to be assessed as well to see if everything is fine with the baby. And as the baby grows, there will be immunizations that are needed. the baby will need vaccinations. So yeah, I think that will also depend on your cost. I didn't really dwell too much on the postnatal stage. Yeah, but one thing I do want to mention though is that if your baby has some problems after delivery, or there was some complications, maybe your baby started having fetal distress while you were in labor, or the baby started getting tired, then there would be a need to assess the baby closely after giving birth, especially if your baby is born and doesn't cry well at birth, or is distressed, or have some sort of breathing problems. Your baby will have to be monitored more closely after birth. And depending on the complication that arose during the childbirth, um, your baby might have to go to the neonatal ICU to be assessed, right? And neonatal ICU will also have its different costs. As I mentioned before, when I was talking about the delivery, I said there is a hospital stay charge that is there. And if you are in a normal postnatal ward and your baby is at the nursery, you both are fine, you have no problems, there'll be a certain cost related to it. But now, if your baby has to go to the ICU, neonatal ICU, because of some sort of complications, or the baby was not fine, then that's another cost on its own, because it's different care that needs to be rendered at the ICU, and your baby needs to be seen by a pediatrician there. So you can pay anything now up to 16,000 rand. So these are big numbers. These are big numbers. So now if we look at the midwife, so if you were being seen by a midwife throughout your pregnancy and your birth was with a midwife, then with some midwives, they can charge you anything between 500 and 800 for those postnatal checkups now after you give birth. So yeah, that's everything on private healthcare. As you can see, it's a lot of money that needs to be spent. So you really need to think carefully about it, and really plan your finances before you fall pregnant, because a lot of care and a lot of money needs to be spent on your maternity care if you will be going the private route, right? Now, what about those people who cannot afford to go to private? It's so expensive, you don't have medical aid. Then public hospital is your option. Public hospital is there, and it's mostly free for people who are not working, right? If you're not working, then you won't have to pay anything. But when you are working and getting a certain income, depending on your income per annum, which is over a period of a year, then you might have to pay a certain fee towards your pregnancy. You might have to pay a certain fee, and that fee will be determined by, there's a patient classification that is done in in public hospitals. So according to your income, they will be putting you in a certain category, and you will be paying a certain amount for the services of the hospital, depending on the category which you fall under, right? So public health is not free. It's not free for everyone. Contrary to what most people may believe, it's not free for everyone. If you are working, if you are having a salary, you might have to pay. So the government will pay for people who are not working, they don't have an income, or maybe their income is less than whatever amount. I don't know the amounts. I actually found it so difficult to find this information. It's so difficult to find any information that has to do with public services. So yeah, I literally just struggled with this one. Yeah, but you'd have to find out when you go to the hospital. But now the thing about public health care is that if you are going for your antenatal visits now, during the antenatal period, you'll either be going to a normal clinic, a small clinic, or depending on whether you have a community health center clinic close to your area, then you'll be going to the community health center for your antenatal, right? And community health centers usually have labor wards where you can deliver, still there at the clinic, but normal clinics do not have a labor ward. A normal small clinic does not have a labor ward, so you will have to go to the hospital. And your hospital will be determined by your area where you stay, right? Even your clinic will be determined by your area where you stay. So if you are going to a normal clinic and you're having a low risk pregnancy without any complications, as I mentioned, or without any medical conditions, or your age is fine, then you can go to your normal clinic for your antenatal visits. Then you will only go to the public hospital when you go and deliver. So if you now were attending your clinic at a community health center, you will go for your antenatal there, and when you deliver or give birth, then you will go to the community health center's labor ward, which is also called a midwife obstetrics unit, MOU. So that MOU is midwife led. It only has midwives, but there are also obstetricians that are connected to that MOU for any complications that arise during the delivery process. And then let me also emphasize this again. Your MOU will be for people who are low risk. If you become high risk or some complications arise while you are in labor, then you will be transferred to a government hospital. Okay, so let's go to the costs. If you are going to a community health center, a CHC clinic, or you're going to a normal small clinic that doesn't have a labor ward, there's no payment. The payment will now probably come when you go and give birth at the hospital. And you would have to give birth at the hospital if you were going to a small clinic that doesn't have a labor ward, or if you had started your labor at an MOU, but now some complications arise during your labor and you have to be transferred to the hospital, then that's where the payment would have to come. If you are having an income, and according to that classification, how much you would have to pay, right? And then another thing that I want to mention is that if you are high risk and you are attending in the public, so your first visit will have to be at the clinic, whether it's a normal clinic or antenatal clinic in a CHC. So that your first visit will be there, and then the midwives will assess you, take your history, check everything, and then if you are having any risk factors, they will send you now to attend your antenatal at the hospital. So now obviously, because public is public, the cost at a public health facility will be less expensive compared to private, right? So even if you are working and you're having an income, some people might choose to actually just go to public. And even if you have medical aid, you might just choose to go to public health care. And I work in a public healthcare facility. I was working in a small clinic in the public healthcare sector, and now I work in a MOU, in a midwife obstetrics unit. So now I'm actually delivering y'all's babies. Yeah. So in my opinion, you know, I would say that, well, in my opinion, in my experience, and in how I deliver my care, I would say that public health care is something that you can consider, especially if you don't have the funds to be paying private healthcare. You can consider it. I think that you can get the same quality of care that you would get in private, actually. Yeah, because I mean, I know the type of care that I give to my patients, and I really think that there are a lot of good nurses and good doctors in public health care, and there are really some good hospitals in public health care that you can go to. Yeah, but unfortunately we know that not everyone's experience of public health care is so great. A lot of people have had bad experiences of care in the public sector. But yeah, also, I mean, in public health care there's overcrowding, so the services might be affected by the fact that there's too many people going to the public health care. There's no equipment, there's no staff, those things matter, and they do contribute to the experience that you will have, right? And healthcare professionals are overworked in public, if we're just gonna be honest. Yeah. Yeah, and unfortunately there also are those people who are just really unhappy. But yeah, I mean, you can have that sort of experience even in private. Well, according to some people and their experiences, they've another person can actually say that, you know what, I didn't have such a great experience in private, but I was paying. So I guess it just depends on the people that you meet. Otherwise, I think public healthcare is an option for many people. It can be an option, especially if you really just don't want to pay those very high amounts of money that are associated with private healthcare. So yeah, thank you so much everyone for tuning into this video. Thank you for listening to me. Thank you for watching till the end. I really hope you gained something from this video, and I really encourage you to comment on the comment section. What was your experience in your previous pregnancy, or are you pregnant right now? Where are you attending your antenatal, or where are you going to deliver your baby? Are you going to private healthcare, or are you going to go to the public healthcare? And if you are someone that has had a baby before, please let me know, what was your experience in private, what was your experience in public? Yeah, that would be quite interesting to see. And yeah, thank you so much for watching this video. Thank you for the support, guys. I really appreciate it so much, and I really thank you. So if you are here for the first time, I really encourage that you subscribe to my channel, you give this video a thumbs up, you subscribe, and you click on the notification bell so that you can see other videos that I will post. And to my returning subscribers, thank you, and hope to see you again next time. Lots of love, guys. I love y'all so much, and thank you for being with me on this Neslali's journey. Till I see you next time. Bye.